Good morning. I welcome Dr. Kostas Papagiannopoulos, Senior Consultant Thoracic Surgeon in Leeds Teaching Hospitals, and invited speaker in International Thoracic Oncology Symposium 2020. The course will provide this year a very comprehensive update of the treatment of thoracic surgery and special emphasis on the multimodality treatments. Dr. Papagiannopoulos, you have a very interesting speech this year in this symposium, which will be fully digital, and it's neoadjuvant treatments for early-stage lung cancer. And is there a role in this? Good morning and welcome, and could you please tell us a few words about it?
Thank you very much, Irene. First of all, I would like to thank the organizing committee for inviting me. It's a pleasure and an honor to contribute in this, although we're running a little bit of difficult times with the COVID pandemic. For those that they will contribute, but those that they will attend, you will see very clearly that this is a very, very interesting program, and I hope that it will be not only interesting, but very interactive. My talk is mainly on neoadjuvant treatment and whether there is a role in the management of early lung cancer. I think it is a very interesting topic, but it's also something that has been discussed for a long period of time. There's no doubt that multimodality treatment in the management of lung cancer has been advocated for a long period of time, and there are now several multi-center trials that they have proven that neoadjuvant or adjuvant treatment in the management of lung cancer, early and late stage, are quite useful and beneficial for a certain group of patients. I think what I will concentrate on my talk will not be just simply showing potential benefits that the neoadjuvant treatment has, but I think what we need to look at is whether we need to provide the appropriate selection of patients. It might not be that one size fits all. You will see that there will be a specific group of patients with early lung cancer that they will benefit from the addition of neoadjuvant treatment. Obviously, in the last few years, we have a lot of work that has been done and a lot of enthusiasm in immunomodulation for the management of lung cancer, and immunotherapy also might be one of the line of treatments as a neoadjuvant role that it might have in the management of early stage lung cancer and on patients that they receive thereafter surgical treatment with a curative intent.
Okay, this seems really very interesting. And how long can you use this kind of treatment? And what is the timeline that we could have some results?
I think you have to select the patient very carefully. There is no doubt that all these people have to be discussed in a multidisciplinary team meeting in an oncology board, as our colleagues from the US would say. And then obviously you need to have an histological confirmation of lung cancer, where you will be able to see whether certain markers are present in these patients. And in that specific group of patients, obviously chemotherapy or immunotherapy might be beneficial before you start the surgery. There are several different schemes that are available and treatments, and I think we might have the opportunity to discuss them when I give my talk. I think the main aims that we're looking at is essentially providing for the patients a good quality of life, the ability to give them surgery without having any added complications after the neoadjuvant treatment, but also we're looking at the expanded essentially role of the neoadjuvant treatment in order to provide a better survival and a better overall survival after the patients receive also the surgical treatment.
And do you think that sometimes they could be so lucky, the patients that could avoid the surgery?
You asking a surgeon to tell you whether surgery is not necessary, I think that will be very difficult for me to say. Specifically, if we were speaking about late stage lung cancer, we would have had a debate for a very long period of time. But I think my role is a little bit easier on these topics because we're speaking about early stage lung cancer, and I think in early stage lung cancer, the surgical treatment remains the mainstay of treatment with a curative intent for lung cancer. What want to see is we want to see the neoadjuvant treatment as a complementary treatment, as a treatment that will enhance the treatment pathway of the patient, a treatment that will essentially assist surgery in providing treatment with a curative intent, and will give life into patients' days, but also days into patients' life.
Thank you very much, Dr. Papagiannopoulos. This was a very interesting interview, and we are really looking forward to hearing your speech during the symposium. Thank you very much.
Thank you very much. I'm delighted to contribute into this, and I'm really looking forward to be part of it as a delegate, but also as a member of the faculty. Thank you.
Thank you.